The Affordable Care Act is officially underway. We'll hear how it's affecting Florida insurance carriers.
It is a first step towards reducing the number of uninsureds in the state of Florida.
Then we'll speak with a Central Florida economist about the impact of this legislation on the economy.
What does it mean to the average family? And I don't think we know that answer yet.
But first, we'll examine the effect of the Affordable Care Act on the medical community and patient care.
What we are really trying to do is focus on proactive preventative care.
3 Central Floridians talk about the Affordable Care Act and what it means to you. Next, on Metro Center Outlook. Hello, I'm Diane Trees. I apologize for the raspy voice. I'm feeling a bit under the weather today, but we have an appropriate topic to discuss. The Affordable Care Act has certainly created a lot of conversation lately about what effect it might have on medical care. Joining us now is Dr. Anjali Vyas, who is the CEO of FPG Healthcare, an accountable care organization. Dr. Vyas, welcome to the show.
Thank you for having me.
Do you think, in a general sense, that most physicians are supportive of the Affordable Care Act?
I think you'll find there are physicians on both sides of the bench on this. I think that a lot of them, if they're smaller independent groups, do feel overwhelmed by the volume of change that's happening in one time period. And they are definitely happy across the board about the increased access to coverage for patients. But on the other hand, a lot of the new rules for them to be compliant for security rules and the new quality reporting has a lot of burden for them to learn a lot in a short amount of time.
With Florida's refusal to participate in the expanded Medicaid, the money there, how is that impacting physicians?
We're refusing funds that would have been very helpful to be able to take care of these patients. From the perspective of primary care physician, a lot of them don't get paid the same amount that they would seeing a commercial patient. So those Medicaid patients don't get the same access sometimes, or sometimes don't have the same network that other patients may have. And so adding more funds to Medicaid would not only expand who would have been covered with Medicaid, but hopefully expand also who would get those services from a more wider network of physicians.
So you think that the Affordable Care Act will help build more of a base for primary care physicians?
I hope so. I really think that that should be one of the primary mantras of what we do here. And there's a lot of things to face that aren't going to, they're not going to move out of our realm of worries just because the ACA has been implemented. We do have a primary care shortage coming up in front of us. So we have to find a way to get more physicians that are coming into the workforce to want to go into primary care and tell them that this is a good place to go into besides specialty care, which is what has had a lot of volume and where a lot of physicians go.
Now, with the Affordable Care Act, there's been a lot of criticism that it steers physicians away from a private practice towards more of a larger medical network. Are you seeing that as a trend?
I am, and I think that is a true statement because the needs for efficiency and population health is very difficult if you're independent. So there's a natural progression of physicians, especially the ones coming out of the workforce now, coming out of residency, to go into an employed model and to have large consolidated networks. I think there's going to be pros to this, and I think there's going to be cons to this that we will have to see as time progresses. The ACA is a platform that will need adjustments and changes as they see if there are some bad unintended consequences of consolidation. We need to address those.
Well, the ACA does move towards a payment system that rewards better, efficient care. How does that differ from the model that we currently have in place?
So it differs in a big way. Right now, if you were a physician and you'd been practicing for 10 years, you usually would be billing fee for service. So your focus is volume and to see a certain amount of patients per day, and that's how you would calculate your profit margins, and you would be focused on episodic care because that is how you are traditionally financially aligned. The new system will be giving you care based on, well, as for the ACO itself, it's based on more of how much the cost of care historically has been per member, per beneficiary, and how much you can save by reducing unnecessary costs. And the caveat to that is not to not provide care. It's to be able to have an incentive to look at where we are being very inefficient with the care we're providing, or not providing care, or providing care that's not necessary. For example, if someone has already gotten an echocardiogram within the last 6 months, but they've gone to a hospital and that hospital doesn't have the records of that last echocardiogram, which is an ultrasound of your heart, they may repeat it if they don't have that information. That is something that's unnecessary.
So it's a duplicate of services. So
Yes.
are you looking at less inpatient hospital stays and services as a result of the ACA?
I think naturally that will happen, because what we are really trying to do is focus on proactive preventative care. So if we're doing the right thing for patients, which is taking care of them before major problems start, naturally you're going to have less inpatient care, because that is where you go for acute episodes of problems that have occurred over time. There is definitely still a value to hospitals and inpatient care. But if we are preventing more complications of chronic diseases, you will naturally see a decrease in inpatient care.
Do you think that with the new rules in place that people will be more prone to pursue preventative kind of care for themselves through a primary care physician?
I think they will. And the reason why, and I'll focus on sectors because it will adjust with different age sectors or different sectors of how many disease burden, your degree of disease burden. But I think looking at the law, the patients that have a large amount of or a few chronic diseases such as diabetes, coronary artery disease, and they're elderly, they are going to really benefit from the fact that we're going to focus on population health, so that they're going to have a team to be able to access that will help them be engaged with their care. And what I mean by that is that currently under the fee-for-service model, if you have 2 chronic diseases, you're seeing your primary care doctor and a specialist or 2. The time you ask questions is in the visit, but so many times you don't ask those questions at that time because it's overwhelming. So they need to know that they have a team behind them that they can contact for education, to know when it's appropriate to go to the hospital, to know about interactions with their medications, and that is when we're really going to see the benefit of this newer model of care, because that will again reduce the amount of unnecessary procedures or inpatient admissions that were happening because of lack of education or medication interactions.
So what do you see as the biggest impact then for the medical community that the Affordable Care Act is really making?
I think the biggest change for them in the short term is that we're going to have to change quite quickly about our clinical workflow, and we're going to have to change with the burden of new regulations that are passed. And what I mean by that is some of the regulations make sense. There are some about security and patient privacy, but to operationally get a clinic to adjust to that requires a lot of investment of money, and it requires a change of how you operate on a day-to-day business. Everyone knows change is hard. So for the short term, I think the medical community is going to feel the brunt of that because it's confusing. There's not one way to slice and dice it. Long term, I think the medical community will improve because the focus on population health is where we should be. We need to focus on how to make a population more healthy, and that is in the benefit of the patient and in the benefit of our community.
That's very optimistic. Thank you, Dr. Villas, for being here.
No problem. Thank you for having me.
When we come back, we'll focus on what effects the Affordable Care Act is having on the insurance industry. Javier Mendoza is the Vice President of Strategic Marketing and Product Development for AvMed. Welcome, Javier.
Thank you, Diane. It's a pleasure to be here.
We're going to talk about the Affordable Care Act, and there is still so much confusion. As an American citizen, am I required now to have medical coverage?
Under the Affordable Care Act, all U.S. citizens and legal residents are required to purchase and or have health insurance. And if you don't have it, then you would be subject to a penalty. But under the Affordable Care Act, U.S. citizens and legal residents are required to carry insurance.
So if I have coverage through my employer, do I need to do anything?
If you have coverage through your employer, you don't need to do anything because you already comply. And as a result of that, when you file your tax return, you would be able to indicate that you do have a coverage and therefore would not be subject to the penalty.
If I don't have coverage, am I required to go through an exchange, or do I have the option to go through private carriers for coverage?
You have the option to go either to the Health Insurance Exchange, which can be found at www.healthcare.gov, or you can purchase insurance directly from carriers. The advantage of going through the exchange is that for individuals who have household income below 400% of the federal poverty level, those individuals would be eligible and may qualify for subsidies in the form of advanced premium tax credits to be used to purchase health insurance. That's where you can get the subsidies, is on the exchange. If you purchase insurance off the exchange, then you would not be eligible to receive those subsidies.
So can my application be denied now?
Under the new rules, those individuals that are eligible for coverage and apply for coverage during the annual enrollment period, which ends now March 31, their applications cannot be denied for coverage. So it's a little different than what it used to be,
Much
especially
different,
in the
yes.
individual space.
Now, the goal of the, and I say the ACA to abbreviate it, but the goal of the ACA was to reduce the number of uninsured. With Florida, we've chosen not to participate in the Medicaid expansion. How's that affecting numbers here for our state?
I mean, obviously, with Florida not expanding on the Medicaid, there will be a portion of the population that will still either have some coverage or may not be eligible for the subsidies. But for the overwhelming majority of individuals who are not eligible for Medicaid, and there are many, the Affordable Care Act will give them access to affordable care, and part of that will be through the availability of the subsidies, the advanced premium tax credits that they can obtain on the exchange. So it is a first step towards reducing the number of uninsureds in the state of Florida, and hopefully over the course of the next several months and upcoming years, we will address the rest of it as it relates to Medicaid-eligible individuals.
One of the biggest, I think, fears that I hear when people talk about the ACA is they're afraid that premiums are going to rise. Are we too early to tell that, or is that a misconception?
Well, under the Affordable Care Act, carriers are still allowed to make adjustments to premiums. Now, what we're seeing is there's certain things, for example, like additional coverage under essential health benefits. That is expanded coverage. There are new rules that come in with regards to how the health plans are rated, how we calculate premiums for individuals. In addition to that, under the Affordable Care Act, all health plans are supposed to spend 80% of their premium, 80% of the premium on medical costs, so for individual and small group coverage. And for large group coverage, 85% of the premium should be spent on medical costs. When you take all of these things together, in some cases there will be individuals who may see decreases in their premiums. In other cases, you may see individuals who will see increases in their premiums. I think overall what we'll see as premiums are a reflection of medical costs. That while it has been tempered in the last several years, medical inflation continues to creep up, and that's also represented and reflected in the premiums. But overall, I think what we'll see are individuals, in some cases, with reductions, and others with some increases as well.
How has the Affordable Care Act impacted private carriers like you?
Well, the Affordable Care Act has about 2,200 pages of legislation, which is the law. And with every piece of legislation, then that produces numerous pages of regulations, which is how we can implement the law. So it's really been a significant amount of additional work. At the same time, it's been some good work because we've been able to implement portions of the Affordable Care Act that are highly beneficial. So for example, preventative care and coverage for that, basically at no cost, is a good thing for the community because it helps to emphasize well-being and wellness and really allow individuals to start taking better care of themselves.
So a lot of that work is just understanding what's actually in place for the ACA, I would think.
That's correct. And the Affordable Care Act went into effect in March of 2010. So we have, since 2010, been implementing pieces of it as the timelines came up. The significant, the bulk of it really came to fruition now in 2014. So I think what we'll continue to see is refinement as the regulations are interpreted, and at times they're not working the way it should be. So like every good piece of legislation and regulation, it doesn't necessarily always produce what its intended results are.
Well, at least right away. What if you could look out 3 years down the road from now? Do you think we'll have the kinks worked out, or is this going to take a little bit more time?
I think we're seeing progress already, and I think we will continue to see progress and the kinks being worked out. The good thing about the Affordable Care Act is that it does provide for greater access to affordable care. What is not known at this point and is yet to be seen are the results of that going to materialize. At AvMed Health Plans, we are very pleased with and support the legislation as it relates to expanding coverage for individuals. So I think that we'll see more work, and we'll see the tweaks taking place and improving it as we go along, because it is a major piece of legislation, and it's taken 4 years to get here, so it'll take a little bit more time.
Well, thank you for clarifying some of the aspects of it. Thank you.
My pleasure. Thank you for being here.
After the break, we'll talk about the economic impact of the Affordable Care Act. Dr. Sean Snaith is the director of the UCEEF Institute for Economic Competitiveness. Sean, welcome to the show.
Thanks for having me.
Let's talk a little bit about the Affordable Care Act. What's the impact for the average American citizen, a financial basis? What's it going to be out of my pocket?
Good question. And I think the answer is indeterminate right now. I mean, there are a lot of moving parts with this law, pieces of which have been delayed as far as their implementation is. So, you know, there's just a tremendous amount of uncertainty as to what, when it's all said and done and the law is fully being implemented and markets and the economy have had time to adjust, you know, what that bottom line is going to be. I mean, a lot of what we heard in the debate leading up to the passage of the law has not come to pass. It doesn't appear that we're going to see a $2,500 savings in premiums for each American family. You know, what will we see? We don't know. And really that is one of the biggest problems, I think, with the law, is that the way the rollout has gone so far and sort of the ad hoc delays in various components of the law, you know, we're just left with a lot of questions, and that's, you know, that's one as well. You know, what does this mean for my bottom line? There are a lot of taxes involved, and so there's so many pieces here that are moving that, you know, when it's all distilled down, you know, what does it mean to the average family? And I don't think we know that answer yet.
Well, when you say the delays and the changes in that, how has that impacted the business community?
Well, you know, I think uncertainty, and particularly policy-related uncertainty, has been a defining characteristic of this recovery, which is a historically weak one, the weakest recovery since the Great Depression. And I believe not knowing answers to a plethora of questions, you know, whether they're related to the healthcare reform law or whether they're related to financial regulatory reform laws. You know, without answers to these questions, I think businesses a lot of times are sort of frozen in place. And for example, when it comes to hiring decisions, you know, it's a basic measurement that a business has to do. You know, will this person bring in more revenue to my company than it's going to cost to hire him or her? Well, you know, you look at that scale, and if they're going to bring in more revenue than it costs to hire them, then they'll add to your profits, and you'll go ahead and you'll make that hire. But when there's uncertainty about what those costs are, you know, what's going to be on this side of the scale, and we just don't know. You know, are premiums going to go up? Will they ultimately go down? I mean, you've heard, I've heard, we've seen numerous studies and reports that are all over the place. And the bottom line is, we don't have an answer to that question. And I think that has made businesses hesitant to hire. If we knew all those answers, whatever those answers were, you know, good, bad, ugly, you know, businesses could then go ahead and navigate forward. It's the not knowing, I think,
The
is the
uncertainty
most.
continues with that. The latest Congressional Budget Office report
predicts that there will be 2 million less full-time workers by, I think, 2017. Do you think that that's an accurate prediction, and what does that mean, if so?
The CBO report, and I mean, CBO is generally held up as sort of a neutral party in assessing policy. They don't come out and say this is a good policy, this is a bad policy. They're presented with a policy, they look at it, and they go ahead and assess what the impact is on the economy. That study was talking about really purely the labor supply side of the impact of this law. That is, people who would just, because of the Affordable Care Act, would leave the workforce. So that's a supply side.
Now, when you say that, do you mean employer or employee driven?
In the labor market, supply side is the employee.
Okay.
So those are workers that say, hey, you know, I don't need to work to get health care. I'm not going to work. I can get it through the exchanges. So that, you know, that doesn't address the demand side. Businesses making decisions about hiring or making these judgments between full-time versus part-time labor and how they're going to manage their labor force. That's not part of the CBO. So the CBO is just sort of on top of whatever the business side impacts are going to be on the labor market. And so I think this is pretty significant impact, particularly in a labor market that's been struggling to recover, particularly with a labor force that has been shrinking nationally. To see here's another 2 million people taken out of the labor force. I mean, labor's a key resource. I mean, it's a key part of the output of the economy, and to see sort of that resource dwindling away, I think has raised some concern.
In a short period of time as well, I think.
Right.
What do you see as the biggest impediment for success for the Affordable Care Act?
I think the size and the complexity. I mean, I really think that could ultimately be the source of its undoing, or the source of its ongoing problems. I mean, this is a large portion of our economy. It's very complex, and to try to centralize all that we have in this law with this sector of our economy, history is not in its favor as far as having the government sort of consolidate that much control over a portion of an economy. Right. It doesn't end well historically.
A lot of people have been tied into their employment because of health care coverage. With other options now, might that spur some entrepreneurial activity?
I guess there is the possibility of that. The poets among us who have been repressed, having to earn a paycheck, as I have, I could just sit out in the field and write my poems. Now, not to be facetious, I think this may free up the ability, because I mean, being without health care insurance is something that is a bit of a risk. Now, of course, if you're an entrepreneur, you should be a risk taker. So if you're afraid to leave your health care insurance to be an entrepreneur, maybe you're not going to be much of an entrepreneur. I don't know. But there may be some freedom in there. But I'm not sure that positive aspect of it is going to make up for sort of the negative impact of a shrinking labor force. At a time when our population is getting older, we're going to see more and more people moving into retirement. So, draining the labor force of people that are of working age, might not be the best thing.
Sean, thank you so much for being on the show. That's all the time we have for our show today. Please visit wucftv.org/metro for interactive features, special content, and much more. Thanks for joining us. Until next time, I'm Diane Trees.